Okay, I think we can begin. So good morning, everyone, and welcome to this morning's webinar. This is a joint ESRI HSE webinar, essentially, where we're going to be talking about the health and well-being in childhood and adolescence. So just by sort of brief introduction, the Institute have been working with the HSE for the last number of years on a series of papers in the area of health and well-being, drawing on the Growing Up in Ireland data. So today we're going to have a sort of the launch and a presentation on the third of the reports, which is about mental health, and my colleague Anne Nolan will be taking you through the details of that report in a few moments. But we thought we'd also take the opportunity to reflect on some of the earlier reports that were brought out as well, and those covered issues of sexual health and health behaviours. And my colleague Emer Smyth will talk about those two, plus today's paper, and to sort of give an overarching reflection on those. So that is the plan for the middle part of the webinar, if I could put it like that. But we're also delighted to say we'll be joined by Helen Deely from the HSE, who will provide some reflections from a HSE perspective, and then later Deirdre McHugh from the Department of Education again will provide some reflections. So I think, as the sort of regular participants in ESRI webinars will know, we always try to get a balance, both of the more research orientated stroke academic side of the issue, but always great to hear from the policymakers and those slightly closer to the coalface as they reflect on the issues. And then hopefully we've left a little bit of time at the end. Hopefully we'll have some time for Q&A, and at that point I'll be asking people to submit questions through the Q&A function at the bottom of the screen. So with that sort of brief introduction, it's my great pleasure to call on Helen, who said will offer some thoughts on the various themes from the perspective of the HSE. So over to you, Helen.
Thanks very much, Alan, and good morning, everybody. Just to give some context, I suppose, in terms of the launch of the report today, the HSE Health and Wellbeing approached the ERSI in 2018 to scope and explore how the Growing Up in Ireland study could inform the direction of our work with children and young people and families living in Ireland. We knew there was huge potential within the data set to increase our understanding of health and well-being among children, young people and their families, which could in turn provide us with useful evidence to inform our planning and our practice. We were fortunate at that stage to be able to set up a funding agreement with the ERSI to broadly explore health and well-being in childhood and adolescence, from which 3 reports were prepared, and the third of which is going to be launched today. Childhood and adolescence are critical periods for the development and maintenance of social and emotional skills, which are important for mental health and overall well-being throughout life. Poor mental health in childhood and adolescence is shown to affect a wide variety of adult health and economic outcomes. Behaviours that cause chronic illness, such as smoking, vaping, drinking alcohol, unhealthy eating, often begin in childhood and adolescence. And these patterns of behaviour can occur when young people are trying to cope with emotional distress and or experience a lack of connection in their relationships at home, in school, or among their peers. This research is telling us that when children and young people experience positive and affirming relationships at home and in school, they're less likely to experience social and emotional difficulties and are better able to cope with life's challenges. The number of friends, the absence of bullying, involvement in sport, and having an adult to talk to about problems emerged as key important and protective factors, which help enhance young people's well-being in the years ahead. Policy and practice are moving in the right direction. Within HSE Health and Wellbeing, we have already begun to use the findings from these reports in our work, referencing the studies and education resources and strategic planning documents, which provide effective evidence-based rationale for the direction of our work. The HSE is also making significant investment to support parents through parenting programs, which are being rolled out as a priority in 19 of the most socio-economically disadvantaged communities in Ireland to the Sláinte Care Healthy Communities Initiative. This is a partnership, multi-agency approach between the HSE, TUSLA and local community development organisations, providing expertise and knowledge of community and community engagement. Deirdre McHugh, representing the Department of Education and Skills, will speak today about the work happening on implementing the Wellbeing Framework for Practice in Schools, which prioritises the importance of positive teacher-student relationships and a positive social environment in schools. These evidence-based initiatives are being implemented at scale and aim to improve the health and well-being of our children and young people. The impact of the pandemic on children and young people gives these developments an increased urgency. Finally, we're delighted to partner with the ERSI in the release of the new report and to listen to the research team present the key findings from all three studies. I would like to commend the research team in the ESRI, Dr. Anne Nolan and Dr. Emer Smyth, for working with us so effectively and for producing such high quality reports. Thank you.
Thanks so much, Helen. Appreciate that opening, and thanks for the kind remarks about the collaboration. Okay, so with that then, it's a pleasure for me to hand over to my colleague Anne Nolan, and Anne is going to sort of present the findings from the latest study, which got a good bit of coverage in the media already today, but good to hear the details. So Anne, over to you, and your screen sharing is working well.
Great, thanks very much, Alan, and thanks also to Helen for giving that really useful overview, I think, of the programme. And I would just like to acknowledge the HSE and also the members of the steering committee. As Helen mentioned, I think it was a really useful way, I think, of having that very important two-way conversation between researchers, you know, who obviously know the data really well, the academic literature, and then obviously having the policy input and the practical input on the ground. I think it was a really useful and constructive partnership, and I'd like to thank all the members of the steering group for supporting the research as we worked our way through the three topics. So what I'm going to talk you through very briefly today are the findings from the third and final report, which is on risk and protective factors for mental health and well-being in children and young adults. And Emer, who's going to follow me, will sort of sum up with sort of maybe the common themes across the three reports. So the background, I suppose, for this piece of research, it goes without saying, you know, that mental health and well-being in childhood and adolescence is an important policy issue. But I suppose it's worth just reflecting on why that's the case. I suppose, first of all, we know that this is a really critical period for the development of adult mental health problems. About half of mental health problems emerge before the age of 14. So obviously intervening at that stage is really important in terms of, I suppose, productive and happy adulthood. And child and adolescent mental health problems can have lasting effects on later life outcomes. So, you know, they can disrupt education and employment opportunities, and can also have, I suppose, longer lasting impacts on other sort of social outcomes, like things like partnership, stability, and even more sort of extreme outcomes, things like criminality. And there's some evidence in the literature as well that sort of mental health issues and difficulties have stronger effects on some of these outcomes than physical health problems in these periods of childhood and adolescence. But I suppose, quite apart from the focus, I suppose, on the importance for later life, it's really important also to focus on current mental health and well-being, and not simply sort of focusing on it as a, you know, a predictor of later life chances. It's important to support our children and young people in the here and now, and to ensure that they have happy and healthy childhoods and teenage years. And saying that, there's real concern rather about increases in depression and anxiety, for example, among young people. And so we know from the My World surveys that were carried out in 2012 and 2018 that there's real and significant and substantial increases in the proportion of young people right up from the age of 12 up to 25 who sort of exceed sort of standard thresholds for depression and anxiety. So these are real concerns and real policy concerns. And it's reflected in recent policy initiatives. So last year we had the publication sharing the vision, the updated mental health policy, which really takes a very sort of broad scope in terms of mental health policy. So not only focusing, I suppose, on those who need specialist treatment and care, but also reflects, I suppose, the continuum of mental health and well-being and sort of the supports that should be put in place right through society at different stages of life. And I suppose that the focus is more on, developing sort of supportive environments and protective environments in which young people can thrive. And Deirdre obviously is going to tell us a little bit more about, the role of schools in supporting those environments. So the objectives of this study were twofold. So first of all, we want to examine how both negative and positive dimensions of mental health and well-being varied across children and young people. And obviously the Growing Up in Ireland data is really detailed, so we have to do a bit of decision making to sort of focus on what outcomes we would look at. So for the negative aspects of well-being, we looked at the internalizing problems score from the Strengths and Difficulties questionnaire. So this is a questionnaire that's filled out, in this case, by the parent of the child or the young person. It can also be filled out by teachers. And it captures various aspects of well-being in young people. So we're focusing on the internalizing problem score, which reflects emotional and peer problem issues. And then in terms of the positive aspect of mental health, we focus on happiness or life satisfaction. I'm not going to focus on those results today, just because of by virtue of time, but I'm happy to talk about them in the discussion and take questions if people have questions about them at the end. And I suppose reflecting that sort of policy focus about the wider environment in which people, young people live, we wanted then to examine the influence of, I suppose, not only demographic characteristics, but also the socioeconomic status of the family. And then I suppose the wider sort of network of relationships within which young people live. So their relationships with their parents, with their peers, and then also their sort of school environment and their teacher relationships, and ask how these factors influence their well-being. So the data, I'll go through this very briefly. It's from Growing Up in Ireland, as we've mentioned a few times already this morning. And I would like to acknowledge the Growing Up in Ireland team, and also the CSO and the Department of Children, Equality, Disability, Integration and Youth, who managed the study and have been very helpful to us throughout. So we're using data from both cohorts of Growing Up in Ireland, the younger cohort, or what used to be known as the infant cohort, who were born in 2008, and we're primarily using the data at the age of 9. So that was collected in 2017, 2018. And then we're also using data from the older cohort, the 98 cohort, who were surveyed at the age of 17 in 2015, 2016. So as you'll notice, these are data were collected before the pandemic. So you have to, I suppose, bear that in mind in interpreting these results. I'll come back to it a bit at the end and mention, sort of developments since then. And I think, we can obviously try and talk about that in the discussion as well. So as I mentioned, I'm focusing on the Strengths and Difficulties questionnaire internalizing problems scores. So these are the sum of scores from 2 subscales of the SDQ, the emotional and peer problem subscales. The score ranges from 0 to 20. It's not important to focus on the numbers here, but just bear in mind that higher scores are indicative of greater difficulty. So what I'm going to show you here is some very broad descriptives about that measure of internalizing difficulties, how it evolves through childhood and adolescence. So there's quite a lot of information on this slide, but basically what it's showing you are SGQ internalizing scores at various age groups in childhood and adolescence. So I'm starting at the age of 3, 5, and 9 for the 08 cohort, and that's the dashed lines. And then the solid lines then just simply reflect that we're moving on to a different cohort. We're moving on to the 98 cohort. Yellow is for females, and the sort of grey colour then are for the males. So if I start with the 08 cohort, so you can see that there's a sort of a broad increase in scores, so a deterioration in emotional and peer problems, difficulties as the children sort of age from the age of 3 to 5, and then particularly from 5 to 9. But there's no statistically significant difference between boys and girls at any of these ages. So the trends are broadly similar. For the 98 cohort, in contrast, we see this gap emerging between young men and young women, particularly as they age into sort of the later years of adolescence and into young adulthood. So you can see there that between the ages of 9 and 13, there's a slight decline for both boys and girls. But then the young women, their scores start to deteriorate quite markedly up to the age of 17, whereas for young men, it stays broadly similar. So again, I'll come back to that sort of pattern at the end, but it also reflects how we do some of the statistical modelling as well, in that for the older cohort, we run separate models for males and females because of that sort of divergent pattern that I'm showing there. What I'm going to very briefly talk you through now are some of the results from the statistical models. Broadly here, there's a lot of information, so I'm just going to focus, I suppose, on some of the high-level findings, but obviously I'm happy to go through some of the detail if people have questions afterwards, and all of the detail here is in the reports that you'll find on the website. So I'm going to start with the younger cohort, the 08 cohort, and this is at the age of 9. And what we do here is we look at the predictors or the characteristics that are associated with scores on the internalizing difficulties SGQ score. And we start, I suppose, first with a set of demographic and socioeconomic characteristics. And broadly, if you see a positive sign, it means that characteristic is associated with a poorer outcome, and a negative sign means that that characteristic is associated with a better outcome. You know, it's a protective factor. So I suppose consistent with the descriptive findings that I showed earlier, there's no significant difference between males and females. Lone parents emerge, or children from lone parent families emerge as a vulnerable group. And this is even when we control for socioeconomic status. It does remove a lot of the sort of the strength of that association, but it doesn't fully attenuate it. Those from sort of higher socioeconomic status families, so whether that be mothers with higher levels of education and or families that have relatively few difficulties in making ends meet, they do better in terms of their mental health. We also then looked, I suppose, at that network of relationships within which young people are embedded. So we looked at relationships between the young people and their parents, with their peers, and also then with their teachers. What comes out strongly, particularly for the 9-year-olds, is that sort of a good relationship, so a close relationship with the mother is protective. On the other hand, obviously a conflictual relationship then emerges as a risk factor. Also as well, parenting style emerged here. So having a hostile parenting style emerged as a risk factor. And also then I just wanted to focus, I suppose, on that sort of what we would term intergenerational persistence. So having a mother who was depressed at earlier waves of the survey was associated with poorer scores. So next I'm going to move on to the 98 cohort. So these are the 17-year-olds. And as I mentioned before, because of that sort of divergent pattern between the age of 13 and 17 in terms of young men and women, we've estimated separate models here for males and females. The results are broadly similar, but there's a few differences in terms of, for example, the sort of strengths of associations between different factors, and I'll try and point those out as I'm going along. So in terms of the main sort of demographic and socioeconomic characteristics of the family, again, we find, that strong association with socioeconomic status in terms of, for example, mother's level of education and difficulty making ends meet. Lone parents, again, so those from lone parent families emerged as, that was a risk factor, again, even controlling for socioeconomic status. I think what's important here as well to notice is that school stage was coming out as important, not so much in the younger cohort, but it is coming out important here, and particularly being in the leaving cert year. And I think we'd all, we can all think of a valid reason why that's the case, given, I suppose, the stresses that young people are under in that time of their school career. At this age, then, we could also sort of distinguish relationships between both mothers and fathers and the young person. And really what emerged here was that the strength and, I suppose, the relationship with the mother that came out as more important than with the father. So having a conflictual relationship with one's mother was associated with poorer outcomes. And again, the maternal depression affect emerged here. Then finally, or rather pronouncedly, we looked at sort of various characteristics to do with the peer relationships and participation in activities. And I think, this has particular resonance given what we know about the last year and a half with COVID restrictions. So, having more friends and better relationships with friends was protective. And particularly for young men, participation in sports was protective. But I think it's important to reflect also that it was important for young women. And we know that young women drop out of sports participation very sharply in their later teenage years. Finally, then, the sort of broader school environment and school climate was protective, particularly so for young women. So, if they regretted their subject choice, if they disliked school, these were risk factors for their well-being. And I suppose consistent with what Helen mentioned, having an adult, one good adult to talk to was protective for young women. So I hope I haven't gone over time, but I'll just very briefly sort of summarize what we found and then sort of mention a few talking points, I think, for the subsequent discussion. So I think one of the main findings and one of the most striking findings, but consistent with international research, is that a significant gender gap in SDQ internalizing problem score opens up in adolescence. Family socioeconomic status and the experience of financial strain are consistent risk factors for both cohorts, males and females. And children and adolescents from lone parent families emerge as a particularly vulnerable group. I didn't mention it in talking about the results, but having a chronic illness, and then for the older cohort for whom we could identify special educational needs, again, these emerged as factors for poorer well-being. Intergenerational persistence was evident, again, for both cohorts and for males and females. And in general, there was a protective effect of positive parent, peer, and teacher relationships. So in terms of sort of very broad policy implications, in terms of the gender gap, I think it does highlight the importance of well-being initiatives in schools. I'll let Deirdre talk us through in more detail, I suppose, the development of the well-being framework in schools, but I think it's probably worth reflecting on the need for sort of well-being at the later stages of the senior cycle in school as well, given, I suppose, what we found in relation to particular pressures around the leaving cert year, for example. The experience of family financial strain was a consistent risk factor for both cohorts and for males and females, which again highlights the importance of poverty reduction and anti-poverty policies in general. So not only in improving, financial well-being in family, but also in terms of broader outcomes for the family as a whole. And then finally, the importance of the network of relationships, and I suppose the increasing role for peers in adolescence and young adulthood. finally, then obviously it would be remiss not to mention the impact of COVID-19. So parents have very real concerns around school closures, not only in terms of the learning loss that their children and young people face, but also in terms of their social development. And we've had recent data just from Health Ireland as well, which have shown declines in well-being. And the GUI COVID surveys, which were carried out in December of last year, show similar large declines in well-being. And it's worth mentioning that Emer and I are working on those data at the moment in the 17-year-olds for the 98 cohort, to publish some work at early next year. So I will leave it there and hand over to Emer.
And Emer has the sort of the broader task this morning of taking us through the 3 studies and drawing out some of the common themes. So anyway, I look forward to your talk, Emer. So over to you.
Thanks, Alan. So as Alan said, I'm going to talk about the common themes emerging from the 3 reports. So the first report was on the clusters of health behaviours, where we looked at the combination of physical exercise, diet, drinking and smoking. And we found 3 clusters: a healthy group, a group that were characterised by unhealthy diet and low levels of physical exercise, and then a non-healthy group that were characterised by higher levels of drinking and smoking. I'll also talk about our second report, which was on sex education and sexual behaviour among 17-year-olds. And I'll also include kind of the third report, which Anne has just talked about. And all 3 reports use Growing Up in Ireland data to highlight the implications for policy development. So the first theme that was quite common across all 3 pieces of work was that there are social inequalities in health and well-being, and that we find that the more disadvantaged groups, measured in terms of education or social class, have poorer health behaviours and poorer mental health and well-being. As Anne mentioned, there's a particular role for financial strain in poorer well-being, in that being exposed to or increasing financial strain during the recession is associated with poorer child and adolescent well-being. And this has implications for broader anti-poverty policy. We also find that lower income groups, especially in rural areas, tend to have a somewhat higher prevalence of not talking to parents about sex at the ages of 13 and 17. But interestingly, we see higher engagement in such conversations among lone parent families. Now, this shows, I'll see if I can get my laser pointer. This shows that the socioeconomic profile of different clusters of health behaviours. So we can see that if we look at the highest social class, the professional managerial group, compared to their overall representation in the sample, that the healthy group are much more likely to come from this background. And we see when it comes to lone parent families that this unhealthy drinking and smoking group are much more likely to come from a lone parent family than those who fall into the healthy group. So this kind of illustrates some of the social gradient that we found. We also see when we're talking about internalizing difficulties at both ages, at 9 and 17 years of age, we can see this stark gradient by mother's education for both 9-year-olds and 17-year-olds. So you can see that you have worse socio-emotional outcomes among those where mothers had junior certificate education or less, and the kind of best outcomes, if you like, among those who had graduate mothers. A second really striking theme across the 3 studies was the gendered nature of health and well-being. Anne has already discussed the fact that young women had a much steeper increase in internalising behaviour from 13 to 17 years of age, and that was quite stark. But we also see gender differences when we look at the other outcomes that we examined. First of all, if we look at the gender profile of the health behaviour clusters, we see that those who had low levels of physical exercise and a poor diet were much more likely to be female. Almost 2/3 of this group were female, and young women were much less likely to fall into this healthy group that combined good diet, physical exercise, and low rates of drinking and smoking. So we see already that there are health differences between young men and young women as early as 17. We also see differences in the information that young people rely on and the sources of support that they have in talking about sex. So we had these questions at both 13 and 17 years of age, and we can see again stark gender differences. We see that young men are much more likely to fall into the group that did not discuss sex with their parents at either age, much more likely than is the case for young women. And we also see that young women were much more likely to fall into the group that discussed sex with their parents at both ages. And we see for both young women and young men that there's a shift between 13 and 17 in their kind of reliance on different sources of information. Parents emerge quite strongly as a source of information on sex at 13, but this has shifted by the age of 17. But we also see gender differences here as well. We see that at 13, young men are much more likely to say they kind of turn nowhere, if you like, for information on sex than young women. And we also see that parents are less important as a source of information about sex for 17-year-old males, not surprisingly, given that they're not having those conversations. We also see differences when we ask young people if they felt any regret about the timing of their first sexual experience. And we find that just under a third of young women report that they have regret around the timing, mostly because they felt it happened too early. And this is twice the figure for young men. So there are important issues there around gender differences in terms of the timing, as well as information on sexual relationships. Now, as Anne mentioned, it's important not only to look at the patterns of behaviour and outcomes, but also to look at those factors that can help protect young people and promote better well-being. We find, as Anne said, that children and teenagers had fewer socio-emotional difficulties where they had close relationships with their parents and where those relationships had low levels of conflict. Interestingly, young people found it easier to talk to their parents about sex if they had a closer and less conflictual relationship. As young people become older, as they move into adolescence, we see that the quality of peer relationships becomes much more important. But those peer influences aren't always positive. They can be an important resource in supporting mental health, mental well-being. But we find that young people who are more reliant on their peers for information on sex were actually less likely to use contraception when they first had sex. And we also find that the composition of that peer group matters. So those who were kind of socializing with an older friendship group were more likely to drink and smoke than others who had a kind of mixed age or socialized with the younger peers. We find relationships with teachers emerge as a very important influence on well-being. So good quality relationships with teachers, so where there's less negative interaction or being given out to, and more positive interaction like praise and positive feedback, that these are important influence on both health and well-being. We actually find that unhealthy drinking and smoking patterns are less evident if the school emphasises PE and sports to a greater extent, and where students are given a greater say over what happens in the school. And as well as seeing that the behaviours are influenced by social background at the individual family level, we also see that the concentration of disadvantage in some schools is linked to a greater incidence of unhealthy behaviour. There's been talk about kind of the achievement gap in terms of DESH and non-DESH schools, but we're also seeing, if you like, a health gap for this group. And we find that negative interaction and feeling disaffected from school are linked to greater levels of drinking and smoking, in particular in terms of health behaviours. And those who, but interestingly, and perhaps quite surprisingly, we find that that group, who are mostly girls, who have poor levels of physical exercise and unhealthy diets, we find that they're actually more withdrawn in the school setting. So they have less positive interaction, but they also have less negative interaction. So if you like, they might be falling between the cracks in school support because they're not visibly acting out. And we find that kind of higher levels of school achievement are linked to fewer internalizing or emotional difficulties and to greater life satisfaction overall. So positive teacher-student relationships emerge as an important protective factor for mental health and well-being in childhood and adolescence. So just to finish, I want to say something about schools as both an influence and a potential site for intervention. And I know Deirdre will have a good deal more to say about this. We were able to look at the extent to which health behaviour varied by the individual school attended, not just the type of school. And we did find that there was significant variation in health behaviour by the second level school attended. And even when you take that into account, the primary school that the child attended also made a difference. Educational stage did matter. We see that there's less physical activity and poorer diets found in the Leaving Cert year than among those in fifth year. And this is consistent with previous research, which showed that kind of other activities get squeezed out in terms of preparation for a high stakes exam. The vast majority of young people in the sample had received school-based relationships and sexuality education by 17, but there was some between school variation in the timing of early information. So we see bigger differences at the age of 13. And we see too, because some young people aren't talking to their parents, that they're entirely dependent on school-based information. And that has implications for the ongoing review of relationships and sexuality education being conducted by the NCCA, and the need to respond to some of the issues coming up in that consultation about young people wanting a better emphasis on emotional aspects of sex education, as well as on issues of consent. Overall, we find the quality of relationships with teachers are more important than formal school policies. So measures to promote school engagement and promote a more positive school climate are likely to have positive spillovers for health and well-being. As Anne mentioned, there's now a strong emphasis on well-being with a new framework, curriculum framework, a junior cycle, but there is definitely a need for comparable measures at senior cycle, especially given the increasing difficulties we find for young women and the role of exam-related stress, as well as the complexity of making the transition to adulthood. Thank you very much.
Two actually fascinating presentations there, but I'm just reminded, normally when we do these sort of events, we just focused on the new research, but it just really struck me there that there is an advantage actually of talking about the accumulated research as well, and it really does sort of bring home the value that this research program has had in terms of sort of developing more and more, as that it's not just the individual reports, it's the body of work that emerges. So it's great to see it so well presented. Again, let me just remind people to be submitting questions through the Q&A function, as that we will have a little bit of time. But before that, great pleasure to introduce Deirdre McHugh from the Department of Education. And Deirdre, again, we're looking forward to getting the inside story, as it were, on the department's efforts in this area. So you're very welcome.
Maybe just to introduce myself first, to say that I'm an education psychologist by profession and regional director in the Northwest Midlands of NEPS. The reason I'm here today is I have responsibility for wellbeing within the department and within NEPS, which includes the management of the wellbeing office, which for the department, which is situated in NEPS itself. So hence I'm here with the wider department hat on, but we'll be making a huge reference to some of the work from the National Education Psychology Service as well within that. And thank you for inviting us here today to link the policy to the research and policy to the practice. And just wanted to congratulate Anne and Emer on such an extensive piece of research. And it's great that it's built over time. And as you said, Alan, that summary was really helpful, reminding us of the previous pieces that came before heretofore. And also just to acknowledge with my colleagues in the HSE who are here today and who have been working collaboratively with us over the last number of years, particularly Orla McGowan here, Maeve McGuinness. We have linked very much directly with them in relation to other work that we've been doing. So it's great to hear and just to acknowledge that the education policy has had an increased focus in relation to wellbeing over the last number of years, and that the study recognises the importance of school climate in the success of wellbeing promotion in school. And as was referenced a number of times, the Department Wellbeing Policy outlines a comprehensive whole school preventative approach to wellbeing and positive mental health. And school climate, also described as culture and environment or culture and ethos, is really a key element when examining and reviewing wellbeing promotion in schools. And you can see here from the diagram what that refers to, and particularly in relation to culture and environment, the importance of fostering a warm and caring and social physical environment where all children and young people are valued, and the importance of the curricular aspects as well in relation to particularly the social emotional elements of the curricular that Emer would have mentioned in relation to SPHE and RSE. The importance of policy and planning. And it's not that we're asking schools to have a wellbeing policy or mental health policy. It's really noting that wellbeing is intrinsic to all the work that happens in education, and that wellbeing should be noted in all policies that are relevant policies and reviewed and monitored on a regular basis. And then, as mentioned a number of times, the importance of relationships and partnerships, especially as Anne and Emer mentioned, the student-staff relationships, the peer relationships particularly, but also the relationships with parents and the wider community and external professionals involved with the school. And in this policy, we have issued statements of effective practice in these 4 areas. And these describe practices operating competently and effectively at that whole school preventative level. And you can see for the diagram on the bottom right, we look at classroom support, which is really the whole school level, school support, the next tier, and then school support plus being the few, and important to work at the universal level and the target level in school. And these statements of effective practice act as key reference tool which help to standardise the approach to reviewing wellbeing in schools. And following an action research project involving primary, post-primary and special schools, 30 in total, we trialled resources and materials and CPD and sustained visits to schools. And we're ready for a national rollout to promote wellbeing promotion in schools. Unfortunately, as with many things, COVID has delayed this particular work. And unfortunately, due to COVID numbers rising recently, again, the importance of student-teacher contact time, and unfortunately now the subcover issue, it's been delayed yet again. We just got a note last week in relation to that. But there is a 3-year programme of support that will be offered to schools to promote wellbeing within the school. So, just to acknowledge, I'm just conscious that maybe it wasn't fully expanded on in Anne's report, but I know from reading the report, the issues of bullying emerged, and being bullied emerged in the research as a major risk factor as well, and poor declining well-being. And this reinforces the need for ongoing review and monitoring in this area as well. In the education sector. So just important to acknowledge that the positive school climate is important in this area as well. And a lot of the research, international research, repeatedly emphasises the importance of positive school culture and climate as a preventative factor. So the department is currently reviewing the action plan on bullying and reviewing the anti-bullying procedures for primary and post-primary schools from 2013. And this review will ensure that the new action plan on bullying is in line with up-to-date and current research, and includes all elements of a comprehensive and holistic and national response to education, by education to bullying. And this is in line with the wellbeing policy, as this is the umbrella for this particular work that that the Wellbeing Steering Group will provide oversight and governance to that work within the department, which is responsible for the implementation of the policy. And the review of the action plan will reflect the significant development and relevant research since 2013, especially in the areas of cyberbullying and gender identity bullying. And the review will also give a detailed consideration to recommendations in the Oireachtas Joint Committee, a report on school bullying and impact of mental health. And as a first step, and in order to inform the review, the department is focusing on obtaining evidence at the moment of the type of bullying that's happening in our schools and identifying approaches that are successful in addressing this. And then just to acknowledge, as mentioned numerous times by Anne and Emer there, the report gives great recognition to the importance of relationships in schools, and the department, and particularly the NEPS as an organisation, a psychological service, really understands the importance of these relationships. And we have continued to run programmes throughout pre-COVID and during COVID, albeit online, to promote relationships and positive relationships in school, as well as that being the key focus of the policy area as well. So programmes many are delivered by general support services, including the HSE health promotion work that is ongoing in schools in relation to the likes of Zippy Sprains and Mind Out programmes. But for ourselves and NEPS, we have continued to offer the Incredible Years Classroom Management programme, which has a huge focus on relationships and attachment related issues. Get Up, Stand Up social skills programme, helping students relate to each other, and the Friends for Life resilience programmes, student support teams initiatives being key as well. And a recent development is a programme called Filling the Gap, which has been developed by our Cork colleagues in NEPS and piloted in schools in Cork. And plans are in development at the moment for a national rollout for this programme. And this is a universal positive psychology intervention to promote happy, affirmative and supportive school environments. And it's about promoting gratitude and altruism in students, and aims to increase levels of teacher praise. Important that Emer mentioned the praise element there, and how significant that is in building positive relationships with our students. NEPS have also been developing resilience and wellbeing webinars that are due to be launched in the new year. The first in a series of these, called the Stress Factor, a balanced looking at the stress continuum, and the key element of this is relationship building as well, and ensuring schools are places where students feel psychologically safe and secure. In addition to that, as mentioned, having at least one good adult in the lives of young people emerges as an important protective factor and highlights the importance of ongoing professional development for teachers. And the Professional Development Service for teachers, the PTSD, their work plans next year include training and support for teachers in restorative practice, and also, as mentioned, this national rollout of CPD and sustained support for implementing the wellbeing policy as well. Special educational needs was mentioned at the end of Anne's report. I know, Anne, you didn't have maybe an opportunity to go into detail, but I suppose I picked that out as important factors to focus on, because we really welcomed that, the spotlight on SEN, and we're acknowledging that these are really an at-risk population within the school setting. I suppose we'd really welcome further research in this area to shine a light on the quality of life issues for children and adolescents with SEN, and they must be recognised as a group gravely at risk, and designing school-based prevention and intervention programs, an effort to reduce that risk is really key, and we'll be working with schools to help them to consider these risk factors for the rollout of the wellbeing policy framework and practice. Just to acknowledge as well that, over the years, the special educational teacher allocation model that was introduced was a positive development for kids with SEN, in that schools have the discretion to offer various supports without diagnosis of a disability or a formal diagnosis of need. It's based on the presenting needs in the school environment, and these programs should very importantly include mental health and wellbeing initiatives as well. The COVID Learning and Support Scheme, you may be familiar with that, more recently has been put in place to help schools mitigate the adverse impacts of COVID-19 on student learning, but also very importantly on wellbeing arising from the periods of the school closure in 2020 and 21. And under this programme, a block of additional teaching hours has been provided to schools for those students who have experienced difficulties re-engaging with learning. And again, this goes beyond attainments in literacy and numeracy, and wellbeing is included in that work that is promoted in school. And up to €52 million in extra teaching hours has been made available to schools. Also, just to acknowledge a huge amount of work in relation to supplementary programmes that were offered to alleviate the impact of COVID-19 as well. That's children from special schools and classes and mainstream schools with complex needs were given a provision of 5 hours in-person teaching and care support to be delivered in homes to complement the work in schools, and over 14,000 students did avail of that programme. And that in May as well, the government announced an expanded summer educational programme to support students with complex needs, also known as the July provision, and a huge focus was put on the wellbeing needs of those students as well, and a home-based strand was also available to pupils with complex needs. NEPS was continue to work at a casework level within the system to support students with SEN and complex needs, and during school closure we're available to do that online and with reopening schools using a blended model of support. And unfortunately on the gov.ie sites there's a range of resources and supports and materials there to support all students. And then lastly, just to acknowledge that we know that students with autism can be adversely affected in many ways, more than maybe others, and prone to mental health and wellbeing needs. And there's been a lot of work ongoing with Middletown Centre for Autism, the NCSE, the National Council for Special Education, NEPS, and the Inspectorate and SEN section of the department to launch a publication for supporting students with autism good practice guidance for schools. And this currently is underway at the moment as well. So really a lot happened in that space, too much to mention, to be honest, in any more detail. Again, I know, Anne, you did refer to kind of the importance of the extracurricular activities, and particularly sports for older men and 17-year-olds particularly, and how young women drop out of sports at an earlier age. And this has really been recognised more recently in the department, and the importance that participation really boosts a young person's sense of belonging and attachment to their school, and the importance of informal learning opportunities. So in development at the moment, there's a policy statement in development to support extracurricular activities underway, and it's expected to be published in Q2 of 2022. And this policy statement will facilitate schools in the provision on a voluntary basis of extracurricular activities after school hours or in school holiday periods. And such activities would include summer camps, speech and drama, music, tuition, gymnastics, debating, homework clubs. So that is underway, and I think a very positive development at the moment as well. And then lastly, again, probably too much to go into detail here, but I know that Emer did refer to the senior cycle and the gaps in relation to that. And many people here today will know that between 2016 and 20, that the National Council for Curriculum Assessment undertook an extensive review of the senior cycle programmes and vocational pathways. And the NCCA advisory report on the senior cycle has been submitted to the department for consideration, and this is going to be published shortly, so hopefully we'll hear more in relation to that shortly. And there's much I suppose going on in the area of SPHE and primary and RSE developments at the moment, but again I've probably gone over time, so I won't go into those in detail unless any questions are raised. Thanks, Alan.
Great, thanks so much, Deirdre. Again, fascinating to hear all the stuff that's going on. So can I say, it's just been a fascinating discussion, and I think we've covered sort of such a range from the very micro issues in kids' lives, such as the home, the family, and friends, and then we've moved right across to the bigger institutional factors that are impacting. But as I said earlier on, if ever there was a sort of a whole of government issue, it really is around health and well-being. So little doubt that we'll be returning to these conversations again. So just before closing then, can I again thank and congratulate my colleagues in Emer and Anne for great research and fantastic presentations. I want to thank Deirdre and Helen for coming along and giving us the benefits of their insights. Again, very, very much appreciated them. And more generally then to the colleagues in the HSE, we realise it has been a difficult and trying couple of years in the HSE from a variety of perspectives, but we very much appreciated the engagement on this work, and as I said, hopefully we'll keep the conversation going into the future. So with that, I think it's time to sign off and just wish everybody again a good day, and hopefully if Storm Barrett is settling down, I think things, at least on the storm front, can return to normal, whatever about other fronts. Okay, so farewell.